pleased that we have been able to have an increase in the budgetary allocation this year over last year. But we also know that there are other health expenditures that are not actually necessarily added when you are talking about expenditure. For example, what are the states budgeting? The states have also budgeted something. And if you want to know what Nigeria spends on health, you have to look at the federal budget, look at the state budget, and look at other expenditures which are not necessarily captured directly in the allocation to the health sector. The allocation to education, for example, to train nurses, to train doctors, is also part of health expenditure. We do have many lessons we are learning in the flow of funds from Basic Healthcare Provision Fund to take care of both the vulnerable and the poor. We will not have enough ambulances to take care of the country, so we are working in the private sector on the principle of pay as you work. So for every sortie that is done, either by the private sector or the public sector ambulance, the service is not, payment for the service is not required immediately, but it is carried out through the National Health Insurance Authority. We are working closely with NHIA to arrange a platform and set up a database of ambulances, accredited ambulances and accredited hospitals which we work with, and where we have developed a template for reimbursing those who have provided service, and so that the patient is not asked to pay anything at the point of care. The ambulances, once they are accredited for mechanical soundness and also for the training of the paramedics, will now be registered and enrolled as providers, and they can be paid when they do a sortie. In the FCT, the lessons we have learned so far is about 60 ambulances are registered, of which about 20 are the private sector, and the rest are both federal and state ambulances. So the private sector is a little bit cautious because they are trying to see how it works. But so far it has worked fairly well, and we have a few clips of what has been done so far. We can share the clips with you of what NEMSAS has done. But the exemplary collaboration between private sector and public sector is being here tested and validated.